Hello, my name is Dr. Joseph Lawrence, and I'd like to give you some information about fibromyalgia that may come to you as somewhat of a revelation. Firstly, fibromyalgia is a neurological problem, not a muscular problem. I know this may come as a bit of a surprise, but there's been a vast amount of research that's demonstrated that fibromyalgia is actually a neurological problem owing to the fact that the individuals suffering from this disease, their brains function much differently than those that do not. It's not common knowledge, and the reason for that is that most of the time when you're diagnosed with this, you're given medication that may be for depression or for muscular pain, and a lot of times it's very difficult to find out what the cause of this diffuse disease is. I want you to know one thing here is that when individuals come to see me for this condition, I mostly focus on treating the individual, not their label. This is important because there could be many different causes for this broad category of what we call fibromyalgia. One of the main reasons as the neurological cause for this is the fact that there's an overaction of what's known as the midbrain. If you look at this chart here, the brainstem is divided into three sections. There's an upper midbrain, and a lower brainstem, and then there's the cortex. Where the problem derives from is that this midbrain, if it isn't dampened or controlled by the cortex and the lower brainstem, there's all sorts of conditions can occur as a result of this. What can happen is you can get blurry vision, you'll be sensitive to sound, headaches. This area of the spine has many connections to the gut that can cause constipation or diarrhea. It can also cause overaction of the adrenal gland. When the adrenal gland is overactive, it'll send cortisol through the system and particularly into the brain where you get this fibro fog. So what's very interesting to understand is that when we diagnose this situation, we use very advanced tools to evaluate whether this upper brainstem is overacting. And there's many ways we can go about treating it, but I don't want to overwhelm you. The information here is important. You need to find somebody that can help you evaluate if this neurologically is the case for your fibro. I'd like to thank you for visiting the page, and we look forward to helping you. Thank you.